Hello, my name is Emma Turnage, and I'm going to be discussing vegan diets in pregnancy. The objectives today are to discuss why vegan diets may not be suitable for pregnancy, discuss important nutrients in pregnancy, and discuss how vegans can improve their pregnancy outcomes. So, vegetarians do not eat meat. There are variations such as pesco-vegetarians who eat fish, or lacto-ovo-vegetarians who eat dairy, eggs, or other animal products. Vegans, on the other hand, eliminate all meat and animal products from their diet, and this is the population that we will be focusing on today. The German Nutrition Society position statement says the DGE does not recommend a vegan diet for pregnant women, lactating women, infants, children, or adolescents. For this presentation, I will be evaluating the first claim that vegan diets are not recommended for pregnant women. So first, I wanted to share some studies that agree with the claims that vegan diets may be undesirable for pregnancy outcomes. So this was a study that included 232 women with 112 omnivores, 37 fish eaters, 64 lacto-ovo-vegetarians, and 60 vegans, all of whom had maintained their diet for at least 3 months prior to this study. And here are the results. Omnivores had the lowest prevalence of small for gestational age newborns. That's the second to last row. And omnivores had 1.79% small for gestational age newborns compared to vegans who had 11.67%. And even after an adjustment for pre-pregnancy maternal BMI and age, vegans' rate of small for gestational age remains significantly higher than omnivores, but not higher than lacto-ovo-vegetarians or fish eaters. There was also a statistically significant difference in birth weight between vegans and omnivores, with the average birth weight for vegans being 3,015 grams compared to omnivores, whose average was 3,328 grams. But it is important to note that although it was lower, the average birth weight for vegans is still within the normal range. Vegans also had a significantly lower increase in gestational weight gain compared to omnivores, which also plays a role in the risk for the newborn being small for gestational age. They found no significant differences in preterm birth, hypertensive complications, gestational diabetes, or C-sections. So just to reiterate, the study found that vegan mothers, in comparison to omnivores, had an increased risk for their newborn being a low birth weight and small for gestational age, and mothers had a lower gestational weight gain. This is a case study of a 1-day-old infant that presented with severe symptoms of riboflavin deficiency. So vitamin B2 or riboflavin is not often considered as a key nutrient in pregnancy, but this is one case that shows that it might be important. So the infant had life-threatening hypoglycemia and lactic acidosis due to this deficiency. The mother was vegan and took supplements with folic acid, vitamin B12, vitamin D, and omega-3. The mother had a riboflavin deficiency, but she was asymptomatic. Proper planning of the mother's diet could have prevented this, but why didn't she get proper planning? The authors provide they say, professionals involved in the care of pregnant women reported awareness of the risks for nutrient deficiencies of a vegan diet during pregnancy, as well as a lack of knowledge for adequate counseling. Only 25% of midwives and 14.5% of obstetricians reported referring pregnant women on a vegan diet to a dietitian, and only 40% of dietitians felt capable to advise pregnant women on a vegan diet. So the care team for pregnant women are aware of the risks of nutritional deficiencies, but not how to counsel them. Even the majority of dietitians are not comfortable with counseling a pregnant woman following a vegan diet. So this just shows that more education needs to be done for those caring for pregnant women who their diet may lack required nutrients, which may lead to undesirable birth outcomes. Here I have some important nutrients in pregnancy. So first, protein. The intake of protein should increase by about 10% when pregnant and lactating, and this should be easily obtained in a vegan diet. Good sources of protein for vegans include beans, grains, nuts, seeds, and green leafy vegetables. Fiber should also be easily obtained in a vegan diet. The recommended intake for pregnancy is 28 grams per day, and it's important to help fight constipation, especially in the second and third trimesters. Iron requirements are almost double during pregnancy. Vegan sources of iron include whole grains, beans, nuts, soy, seeds, and green leafy vegetables. Cooking techniques can also improve iron intake, such as using a cast iron skillet. Zinc is important to help reduce preterm births. Plant sources include grains, legumes, soy, nuts, and seeds. But it is important to note that the absorption of zinc may be impaired by fiber and phytate, so it is recommended to consume vitamin C or other organic acids like those found in fruit within the same meal to increase absorption. Calcium requirements are also increased during pregnancy. Vegan sources of calcium include most green leafy vegetables, sesame seeds, cruciferous vegetables, almonds, fortified plant-based milk or yogurt, soy, calcium-set tofu, and dried figs. Iodine is important in thyroid hormone synthesis. Iodized salt is easy to obtain in the US, and within the US, 1 gram of iodized salt contains 45 micrograms of iodine. So 5 grams provides the recommended 220 micrograms per day for pregnant women. However, if salt intake needs to be limited, algal supplements of iodine can be taken. For vitamin D, the best source is sun exposure. If they are not getting enough sun exposure, so if they have dark skin, living at a high latitude or in a cold climate, supplementation with vitamin D2 or D3 is recommended to obtain adequate levels of vitamin D. Pregnant women should consume between 600 and 2,000 international units per day to maintain a serum 25-OH level above 75 nanomoles per liter. And this recommended intake varied. I saw as low as 400 IU per day. Most prenatal vitamins contain a level of vitamin D to be adequate for pregnant women. And it is important for healthy bone development in the fetus, along with calcium and phosphate. Insufficiency or deficiency of vitamin D is also associated with preeclampsia, low birth weight, neonatal hypocalcemia, poor postnatal growth, bone fragility, and increased incidence of autoimmune disease. For B12, supplements must be taken since there is no reliable plant source of B12. It is important during pregnancy for the development of the brain and spine in the fetus. Omega-3 fatty acids are important to reduce the risk of neural tube defects. Supplementation of EPA and DHA is important since vegan dietary sources only provide ALA, and there's a low conversion rate of ALA to EPA and then EPA to DHA. This is the last study I have. It is a systematic narrative review that included a total of 22 studies. 13 of them are on maternal or fetal outcomes and 9 on dietary deficiencies. All of them were observational. They were prospective, retrospective, and cross-sectional studies. They found that there was no significant difference in the risk of adverse pregnancy outcomes such as preeclampsia, HELPP syndrome, or hemolysis, elevated liver enzymes, and low platelet count, and major birth defects when adjusted for vitamin B12 and iron. They found contrasting results between studies for both birth weight and the duration of gestation. 5 studies found lower birth rate and 2 found higher birth rate for vegan mothers. And for gestation, some studies reported shorter gestation, however, it was still within the normal range. The authors state that when vegan and vegetarian diets are the result of a free choice and are not linked with limited access to food or with poverty, pregnancy outcomes are similar to those reported in the omnivorous population. These findings are in line with the statements of the American Dietetic Association and the Canadian Dietary Association, which state well-planned vegetarian diets are appropriate during all stages of life, including pregnancy. So, in conclusion, vegan mothers may put their neonates at risk for low birth weight and small for gestational age. However, this can be fixed with proper planning, which is needed for following a vegan diet during pregnancy and to get the best outcomes for birth. Additionally, dietitians should be educated on how to advise vegan pregnant women. Thank you so much.